And our continuing partnership with the Columbus Medical Association, we take a look at blindness. Many of us really don't appreciate how precious our eyesight is until we begin to lose it.
And there are numerous conditions that can cause blindness. Here to discuss macular degeneration, our health team ophthalmologist, Dr. Alice Epitropoulos. And Dr. Epitropoulos, tonight let's begin with some of the leading causes of blindness, including macular degeneration.
Yes, the most common causes of blindness include glaucoma, cataracts, trauma, and macular degeneration.
And can you get a little more specific with macular degeneration?
Sure. This is a condition where the macula, which is the part of the eye that allows us to focus on fine details, becomes damaged. This causes a loss of central vision, making it difficult to perform various activities such as driving and reading and even recognizing people's faces. There are a couple forms of macular degeneration. There's a dry form and there's a wet form. The dry form is the less severe type, and it's characterized by small deposits called drusen in the back of the eye, and it causes a slow and sometimes progressive loss of vision. The wet form is characterized by the growth of abnormal blood vessels growing through the retina and causes a leakage of fluid, bleeding, and scar tissue.
So who will most likely get this, or don't we know?
Well, it's the most common cause of vision loss in those over the age of 50. And that's why they call it age-related macular degeneration. But younger people can also get it. You know, in the earliest stages, you can get blurred vision, distance, and also reading. And a very common and important symptom is distortion. Lines may appear distorted or wavy. One may notice a blind spot in the central vision, and if any of these symptoms occur, it's real important to report that to your eye doctor.
Now, what causes this, and is there any way to treat this?
Well, the cause is uncertain. Research has suggested that heredity, certain environmental factors such as ultraviolet rays, smoking, and also nutrition play a role. Unfortunately, there is no cure for macular degeneration, but there is a recent advancement approved by the FDA called photodynamic therapy that's approved for wet macular degeneration. And this has been shown to slow the progression of this type of disease. And the way that it works is it destroys these abnormal blood vessels in the macula without affecting the healthy tissue.
So if we don't know what causes it, is there any way to prevent it?
Well, that's a good question. As with most conditions, early detection is key. Seeing your eye doctor on a regular basis, wearing sunglasses, good nutrition. A recent study from the National Eye Institute noted taking vitamins with zinc and antioxidants to minimize any progression or even prevent the formation of dry macular degeneration. The other thing is it's important for patients with macular degeneration to monitor their vision at home using something called an Amsler grid. This would allow them to report and detect changes early.
So they can see how they're progressing, and if they have to see their doctor, they would go back.
Great. Dr. Epitropoulos, thanks for joining us. We'll see you again next month.
Thanks for having me.